first, who I've actually found is become a good friend and as well as a leading expert, Lori Orlov. She's going to be leading our discussion, and she is the founder of Age and Tech Place blog. Also, following her, Sherwin Sheik, and he is founder and CEO. Why I keep like forgetting stuff? CareLinks, and actually the leader in caregiver marketplace. He's done a ton with his company, and he's really started to transform that experience. Following that, we have Dr. David Rue from Samsung, and he is the Chief Medical Officer and Head of Healthcare and Fitness at Samsung. Particularly, senior care is one of their focal points inside of their industry and what they're doing in technology. They are the global leader. Don't have to say much about that. And we have Geir Renwick from Lyft. He is actually the lead in regards to sales, but also business development. And he has some really unique solutions that he's doing with those who are aging. What I really want to kind of, if there was a theme for my former English teacher world, each one of them bring a unique solution to the caregiving marketplace. And hopefully, we have a very engaging conversation to really enlighten all of you as you all settle down, come in from lunch, have your bellies full, ready to talk. So I'm going to go ahead and get started. And Lori, if you want to kick it off.
Okay, can you hear me? I knew that was going to work. All right, I'm going to talk to you a little bit about, I don't think I need to explain who I am. My bio's lying around here somewhere, but I'm very interested in the topic of technology for home care. I believe we are not yet entering, but are about to enter the world of tech-enabled home care, which I describe as home care, home health care, family caregiving, and the augmenting of senior housing resources with home care workers. So I'm extremely intrigued by this space, which I think is going to see an absolute flood of technology offerings, and the question is, how are they going to really provide utility for those of us who may engage home care in our lives? So I just wanted to, because this is titled The Logistics of Home Care, I thought I would just remind myself what the term means. The term originates in the military, and it means the detailed coordination of a complex operation involving many people, facilities, or supplies. And if there's anything that describes the world of home care and caregiving, it is, in fact, that it needs detailed coordination and doesn't get it. We're talking about an amazing set of inefficiencies across multiple segments, and given growing labor shortages in urban areas, rising price bumps that are bumping into the willingness of people to pay, population areas that are plagued by lack of workers or lack of housing for workers, transportation issues, it's a problem. So there's a crisis brewing, and if you haven't all read about the caregiver support ratio report that was published by ARP in 2013, this crisis was about the fact that by 2030, there was going to be a shortage of people in the appropriate age ranges to provide care for the population who was going to be 80 plus. And what we've looked at from the US Census data is that already there are counties in the United States, including Palm Beach, Ocean County, New Jersey, and Barnstable County, that are already there. These people who are in the 80 plus age range, I refer to as stranded. They're in places where there simply aren't enough people to provide them with care. So if you take a look at this, I feel like, with all the discussion of wealth of the people who are age 75 plus, I'm sort of the Eeyore of this industry. And I go and find all the data that is actually really strikingly negative, okay? And so if you look at the crisis in stark terms, look at the age 75 plus population. The median net worth of that population today is $156,000 inclusive of home equity. These folks are not going to assisted living anytime soon. They are private pay. And I believe they are providing sort of the baseline characteristic why the assisted living industry may not be growing as fast as it might be. But what surfaces in this space is a crisis of inefficiency and market mismatch. So let's take a look at the tech world that's supporting that. I don't think I have to tell you about all the capabilities that are out there relative to miniaturization and AI and the ability to talk to technology now. We all know about these base technologies. They have not been connected in a way that is useful in the delivery of the care. We are at the cusp of being able to do that. It's most important that you first have a backbone of base technologies and then connectivity, and then innovators can create capabilities that are relevant and useful. And so what happened in 2015 was a really startling change in the home care industry. And the fact that $100 million went into 3 tech-enabled home care companies in 3 parts of the United States says that somebody thinks there's the beginning of a trend. And the problem with version 1 in general in the technology world, or version 1 of services, is that the next version will actually be better. So let's take a look at, I'm not going to talk about lower reimbursement or everybody's age. We'll just skip that part. So if you look at the care transition world and you think about what the backbone of capabilities relative to home care and care delivery need to support, they need to support that Mrs. Smith in her later years is going to be bopping in and out of environments, possibly discharged from the hospital, possibly going to rehab, undergoing numerous transitions from place to place, and Mrs. Smith's identity is barely remembered in the place that she's in, let alone the place she's about to go to or return from. Does the visiting nurse travel with her? When you go to the hospital and you admit a person who's 80 plus with dementia, is there somebody there that actually can speak to Mrs. Smith appropriately about her care if her family isn't present? And I'll just give you a tiny anecdote. Take 1 second. I'll skip all the rest of the slides just to tell you this one anecdote, which is with my own mother-in-law who has dementia. She's 93. And we were in the emergency room, and the doctor says, "We're not going to release her until she talks." Okay. So look at this. So let's take a look at the hierarchy of capabilities that I believe will exist in a home care information network, which I have actually written about, so no need to think it up. It's a Maslow's hierarchy of needs that I envision will be available to us in home care 3.0, not in 2.0. We're sort of entering 2.0 right now. It would be in 3.0. And in 3.0, we're going to have a transparency of information across the various entities that I just described, and it will carry information all the way from the base level, lowest level of Maslow's needs, medications, to the highest level, which is integration and interaction needs of people to get along and know other people. So if you think about communicating and coordinating and collaborating across organizations that deliver care into the home, which would be all of the currently not so well connected with each other agencies that deliver home care, senior housing, that visiting nurses, and everybody else, we have a big opportunity for innovation, integration, connectivity. And we need to make it happen. And finally, I think I'll just show you no, I won't bother with that. However, the most interesting thing I think that's about to happen is the end user and the voice enabled everywhere, and I want to be able to say to my Amazon Echo device, I need help. What are my 8 o'clock meds? I need help, or what time is it? And we're getting there. We can do that now, and other technologies are coming into the market to be able to do that. Finally, I'm going to just mention that the lack of integration across the various pipes, if you will, that are in the space, who could in fact communicate better using the Internet of Things and more tech-enabled services, will in fact be collaborating more. Ripe for innovation is the DME, HME industry, which is really frightened by the lowering reimbursements into their space and wants something new to sell. So I will wrap it up by saying the future, in my view, will be in software, not hardware. There will be hardware, but there are an order of magnitude more software possibilities than there are with hardware, and the platform needs to be leveraged across lots of organizations. Build the hardware once, propagate the software many times. Thank you very much.
There you go. Hello, Sherwin. Here you go.
Hi, I'm Sharon Sheik, the founder and CEO of CareLinks. Love Lori's statistics. She always shines, obviously, the obstacles and challenges facing the industry. But one thing I would like to talk about is all the new innovations that are happening in what's happening on a macro level, even from the payer perspective, that's really helping drive innovation. And so let me first give you an overview of CareLinks. What we are is the largest caregiver marketplace in the United States. We have over 150,000 professional caregivers ranging from CNAs, MAs, LVNs, all the way up to RNs. And really, we're helping families find the right caregivers who match their specific needs and budget. And we're focusing on these three major problems. I've been dealing with caregiving for over 20 years. My sister has multiple sclerosis and my uncle had ALS. But one is in-home care is very expensive. On average, people are spending about $100,000 out of pocket on in-home care support services. And right now, the industry is dominated by traditional franchise models that mark up the cost of care between 75 to 150%. Families are very overwhelmed. My mom was a PhD molecular biologist that was forced into early retirement because the amount of time she had to take off of work dealing with the caregiver turnover, agency turnover that we're having. And so what we needed to do is make it easy for families, if they live long distance, holding down a full-time job, to find the right caregiver. And then lastly, looking at the 20 years of the caregivers that we had, there's a very clear observation. The best caregivers were like family. And when we looked at the agency model, they optimized based on utilization of staff, rather than really finding the right match for your loved one and for your family. And so that's where we came up with the CareLinks model. And so we really, again, want to just match families and the patients, their loved ones, with caregivers on multiple dimensions of compatibility: gender, language, obviously disease state, budget. All the caregivers are vetted, background checked, and covered with $4 million in insurance. And then we provide very seamless, easy to use web and mobile solutions that really keeps the family and caregivers and even care team in the health systems informed of what's happening with their loved one on the day-to-day basis. One beautiful thing that's with the marketplace business model is, as Lori indicated in one of her slides, this great growing shortage of professional caregivers. So there's 78 million baby boomers that are out there. There's 5 million professional caregivers that are in the labor force. So there's going to be a growing disparity between demand and supply. And so what our model really does is really encourage more people to enter into this workforce, because we don't set wages for the caregivers. And so as a result of our marketplace design, we're saving families up to 30%, while professional caregivers are earning between 25 to 30% higher wages. And they're having schedule flexibility, being matched with families that they're most compatible with, and we're seeing lower retention rates as a result of that. And so that's where technology is really kind of disrupting the paradigm of the traditional agency brick and mortar model. That's supposed to be a map of the United States, but we started off in the San Francisco Bay Area, and we're now nationwide with 150,000 caregivers. This kind of just shows the technology where the family gets visibility of when the caregiver arrives, when they leave, all the activities of daily living that they did, upload imagery for showing completion of tasks. But this is where I really want to focus on, and for you guys to really understand where the opportunity is in caregiving, and that is what's happening within the health system. So we are now moving, just raise of hands, how many people know what the word we're moving into a capitated bundle payment model is? Okay, so not that many, but let me just try to distill it down really quick. We're moving into the world where hospitals are no longer going to be able to charge for every single exam that they run and tests that they run. If you come in for a particular condition, you get a fixed payment no matter what happens with the outcome of that patient. And as a result, these health systems are also accountable for these patients 60, 90 days even post-discharge from the hospital or the SNF. And so it's a changing environment where they now need to understand what's happening in the home setting. So where CareLinks is fitting in, and where a lot of caregiver technology, which is what this panel discussion is about, is how to capture that data of what's happening with the patient in the home and effectively send it back to the family and key stakeholder decision makers on a clinical level that can intervene to reduce the likelihood of readmission back into the hospital. Because the last thing they want is that patient to get back into the hospital. So what we're doing is digitizing care plans, making sure that the professional caregivers in the home know what to do to keep these patients safe at home as long as possible. That's a massive trend that is not stopping, that if you want to understand the caregiving industry, you have to understand the people who pay, and eventually the health systems themselves will be paying. So I want to just leave you with that.
Hi, I'm Guy Renwick. I recently joined Lyft earlier this year. Before Lyft, I was at Google for the past 13 years, leading all the healthcare initiatives across Google. At the end of my time at Google, I actually worked on autonomous vehicles and became really passionate about the idea of actually taking Google's autonomous vehicle technology and applying it to the healthcare space. The reality is the regulatory issues, the technology was probably 3 to 4, maybe 5 years down the road. We were excited because we were doing dozens of trips from Google's campus over to Stanford Hospital, transporting patients back and forth. So when I came to Lyft, it was really, in some ways, fast forwarding 4 or 5 years. The idea today is, can we take Lyft technology of ride sharing and apply it to the healthcare community? If you look at the barriers today, Lyft is an app-based program where you pull up your smartphone, you click a button, on demand a ride can be there in a matter of minutes to actually pick you up and take you wherever you want to go. Now, if we apply that to the healthcare community or the senior space, smartphones are a barrier, the use of technology is a barrier, and just comfort using even getting into a Lyft is a barrier. So we had to take that whole idea of what Lyft could do from a platform perspective and change the way you could actually get that access. So what we did is we took the app environment that you feel on Lyft today and actually gave that to the hands of caregivers, hospitals directly, family members, or anyone that could call the Lyft on behalf of another individual. So what that looks like today is I can pull up a website. As a case manager, I can upload a single ride on demand, or even potentially thousands of rides for the next 3 weeks for every patient that I have coming and leaving an appointment. That can be uploaded into the system, tapped into Lyft drivers today, and then you're taking that barrier of transportation to be able to provide health care for individuals. So we looked at today, we found that around 4 million people are missing medical appointments every year, just 100% due to transportation. On top of that, the ones that don't miss the appointments are relying on family members to take time off work, to take them to their dialysis appointments, or take them to their chemo appointments, or even just general routine checkup. So when we first started, we actually went after the Medicaid space, Medicaid and Medicare Advantage. In that industry alone, there's over $4 billion spent on transportation today, and the reality is over a third of that is spent fraudulently, inefficiently, and there's lax reporting and accountability towards it. So what we found is what Lyft's platform, we can actually allow individuals to take medical transportation through the Lyft platform at no cost to the individual, charging back towards Medicaid or Medicare Advantage, and then provide the care they need to get to those appointments. So that's how we got started. Since then, we've been partnering with Medicaid plans directly, transportation brokers, health insurance plans on the commercial side, as well as hospitals, senior nursing facilities, skilled nursing facilities, daycare facilities, really across the space right now. Over the past 4 months, we've done close to 500,000 rides specifically that we know are in the healthcare space right now, and we're doing close to 50,000 rides a week right now. So it's incredible growth that we're seeing today. At Lyft, I think its background has always been about solving transportation problems that impact communities. We feel that the healthcare community, in this case here, is incredibly in need of transportation, and we can do all this work in terms of technology to bring healthcare into the home, provide better technology into the actual health systems. But transportation, in terms of getting patients to the need of those appointments, is an incredibly important piece, and we're really committed to being able to solve that problem today.
I'm the Chief Medical Officer and Head of Healthcare for Samsung. Most of you know Samsung for our smartphones. You know us for our televisions, our home appliances, but what you may not realize is that Samsung has a fairly large presence in healthcare, especially globally, but more recently, greater emphasis on digital health. One of the areas that we're particularly interested in is how can technology improve outcomes? When I talk about outcomes, I'm talking about quality of care, access to care, patient satisfaction, cost, and efficiency. And one of the things that we've been thinking quite a bit about is if we were to target a group of individuals where we could have that greatest impact, who would that be? And we have identified that the senior population is an area we'd like to spend a lot of time thinking about how these technologies can be deployed. What we'd like to do is we'd like to make this technology seamless, secure, easy to access, part of one's workflow. Traditionally, healthcare has been about providing technology for healthcare providers, even caregivers. What we want to do is we want to be able to take that technology and see if we can engage the actual patient themselves, the consumer, the senior, as well as their family and friends, make them an active member of the healthcare team. And as part of that, we've identified that there's potentially an opportunity to use what we call mobile hubs. And these are hubs that individuals can hold with them, they can carry with them, they can wear with them. What we found is that the traditional mobile hubs are the smartphone, the tablet, and the wearable. And when I say wearable, I oftentimes think of the wearable on the wrist, but it's also the wearable that one could have as a patch. It could be a wearable on the head. There's multiple different form factors. And within each one of them, we've recognized that one of the biggest barriers today is that mobile technology is assumed that once you give it to an individual, it's experience it, or if you can't figure it out, then it's not good for you. So when you look at the statistics for seniors, looking at, we use tablets for instance, about 20 to 30% on average use tablets, which means about 60 or 70 to 80% do not. And what is the reason? Well, researchers that looked at this found that it wasn't because that it needed to be dumbed down, it was because there were certain barriers to its use. And in fact, there's 43 configurations that need to occur to make a tablet much more accessible. We're not talking about increasing font size and stripping out features. We're talking about removing the complexity of a lot of these applications and putting it behind the scenes and making it such that it's much more intuitive, easier to use. We found a company that did just that, Breezy. They're based in the UK. They're now back in the US, or they've been brought into the US. And to really better understand the impact that this can have when you start having individuals use it, the National Coalition on Aging ran a pilot project with Breezy, supported by Verizon, in 225 seniors. And these are individuals that were low income, had zero to no technology experience, or actually zero to little. And what they found is that over a 3-month period in using this application, in conjunction with a health program sponsored by NCOA, they found statistically significant improvements in not only technology adoption, but also understanding of how technology worked, and most importantly, health outcomes. Physical activity, mental cognition, social emotional connectedness. And what we're finding is that when you can unlock this opportunity and allow seniors to be able to use these tools, they actively use it, and it becomes a very important part of their lifestyle. We're finding the exact same thing with handsets. Gociety is a company that's based out in Europe, being brought now into the United States. They found that with the smartphone, you have tremendous opportunities with the GPS that's built directly into it, allows for geofencing, allows for, with the accelerometers, fall detection, PERS, emergency response systems, multiple different use cases. And wearables, we're finding tremendous opportunities there. But ultimately, all of this needs to be tied together, and what we've been finding is that when you combine the mobile hubs with the smart home technology, having an ability to understand all the different technology and data feeds, but then most importantly, being able to be proactive in terms of understanding what this means, who's at risk for certain events, how can you prevent certain things, you can have a dramatic impact on health outcomes. Thank you very much.
Hello? Am I on? So just really quickly, because we had started a little bit later, I want to make sure our timing, how much time do we have? 5 more minutes, okay. Which doesn't give me a lot of robust discussion. And we could probably have it, as we know, there's tons of caregiver conferences that just speak specifically to the technology. But because all of you provide a solution to some problem in caregiving, and Lori, I know on your view, you're looking at all of the technologies and trying to be that trusted advisor. Where do you think, if you could look at all the problems, and there's so many in the caregiving space, what do you think is the one challenge or 2 challenges that you believe needs to be addressed by technology to bridge the gap? Because we've heard Ken say, we know technology is going to bridge that gap. We know there's not enough caregivers. And Lori says it's going to be software, she thinks. What do you all think?
Interoperability. So I really believe that we have a lot of great devices and technology is being developed, and we're capturing a lot of this robust data that can help improve patient lives. But if that data cannot be shared in a secure and seamless fashion, it's all for naught. And so when I look at one of the biggest barriers that we have as an industry, it is basically being able to communicate with the Epic, the Cerners, the Athenas, Samsung devices, you name it. That's probably one of the biggest things facing this industry is the interoperability between the technology platforms.
Okay.
So I look at it a little differently, and I come from a technology background, but I also think quite a bit about what's been proven in health outcomes. So there's a gentleman named Don Berwick who some of you may know led IHI, and he had a really interesting graph that they presented at one of the meetings where they talked about what impacts health outcomes the most. And in a controlled setting like the hospital, it's the system, it's the healthcare providers, and much of that today is what ultimately determines whether or not individuals get better or worse. When you move outside of that, and the farther away that you get from the actual health system, it becomes the patient and the consumer that drive the best outcomes. What that means is there needs to be technology solutions that can allow the patient and the consumer to be better informed and more engaged. And in order to do that, we have to change our paradigm of relying so much on healthcare providers, so we have to empower patients and consumers to be able to allow them to become much more active and activated. The only way we can do that is we have to think about technology as a platform for seniors and for the general consumer population that allows us to be able to seamlessly capture information. We need to think about the workflow compatibilities, and make this a part of their lifestyle. And once that occurs, then we have a direct communication line where healthcare providers can communicate directly with consumers and patients.
Gar and Laurie, do you have any thoughts?
Yeah, I would say from the perspective, I think to jump onto that one as well too, I think from the outcome for patients, I think as we look at the level of information that practitioners are able to get from their individual patients, I agree within the hospital themselves that piece is becoming limited. I think the other piece is how do we leverage technology to get more information back to the practitioners themselves. So when I was at Google quite a bit, we were always looking at how can we collect data from Google Health, which was one of our products, and actually not only just to be able to empower the individual patients themselves, but how do we take the patient's data beyond the hospital around their sleep patterns, their eating patterns, their exercise patterns, and actually bring that back to the practitioner. So when the doctor is having that face-to-face with the individual, there's so much more value in those interactions. So to me, telemedicine is not just how do we connect with physicians to get the care that we need, but how do we also bring the data back to the physicians on a more regular basis.
The only thing I would add, the biggest challenge is the pace of change of technology is getting a little bit too fast for absorption among even people who are really technology literate. And one of the things that I think is problematic is technology a lot of it is shipping into the market with what I would call the default is that your permissions are opted in, that you agree to share information. And if you want to actually not share certain information, such as your location or other things, you have to basically set defaults to opt out. I don't think a lot of people understand that, and they're purchasing devices and they accidentally have opted into sharing of information. I think that's a real challenge, and it's creating a mistrust of technology change. And I would say that mistrust by the news media about all the break-ins and thefts of identity that are going on in the marketplace today, that mistrust is growing. So that's the challenge, is when you have growing mistrust, you have a fast pace of technology change, and you have defaults set to share that you have to shut down. I think that's challenging.
So we only have like a second. I'll do my very best to wrap it all up, but I think the reality is, I think the latest statistic was there are 75,000 healthcare applications in the App Store. And trying to kind of navigate and figure out what's that game-changing technology that's going to help support caregiving. I mean, that's one of the things I think is unique with this group up here is that they're using the benefit of technology. They're not necessarily driving the technology where that's leading them, but they're using the technology to help them deliver a service or support or something that is going to support care. And I think that's probably ultimately a lesson learned is that whatever is created, the benefit of care and how that care is optimized is going to be very important to transform this marketplace. Well, I don't think we have any other time, so it was so good to talk to you all, and please come and see these guys.